Hello friends, today I'll be talking to you about treatment of seizure disorder. In the previous lecture of seizure, I've told you types of seizure, pathophysiology, and what other different type of syndromes, all these we covered. So today we'll talk about treatment of seizures. Well, before I discuss treatment, let me tell you what was there in 17th edition of Harrison, what came in the 18th edition of Harrison, and what change has occurred in the 19th edition of Harrison. Once you know by sequence, then your concept about treatment will be very, very easy, especially for the exam point of view. So in 17th edition of Harrison, there was a table like first line treatment, second line treatment, types of seizure was generalized tonic-clonic seizures, absence seizures, myoclonic seizures, then atypical absence, and various other types of seizures. First line treatment was valproate, then many more. Second line, many more. Valproate, many more. Valproate, many, valproate, many. This what came in 17th edition. That means one drug which was universal in all the type of epilepsy was valproic acid, valproate. The year 17th edition came to the market. Same year, in the next coming exam, in PG entrance, the question was, what is the drug of choice for absence seizures? Valproate, phenytoin, carbamazepine, and topiramate. This was the ethosuximide was not in the list. So beyond doubt, answer was valproic acid. Now, when 18th edition came, in 18th edition, what he did, he shifted valproate, and sorry, I forgot to write about focal seizures. Focal seizures. Focal seizure. Focal seizure. Focal seizure. Again in 17 valproate. Now in 18th edition, everything was same, but he shifted in focal seizure. He shifted valproate from first line treatment to second line treatment. In the year 18th edition came, in the next entrance exam, the question was, which of the following drug has got widest range of anti-epileptic action? The options were valproate, carbamazepine, phenytoin, and gabapentin. Obviously, answer was valproate. Now 19th edition has come. What change has done? Valproate was पहले भी यही था. It was in 17-18 edition, valproate was here. And in 18th edition, valproate came here. In 19, again, valproate here only. But a new drug which has been introduced as a first line treatment is Lamotrigine. Lamotrigine. Again, Lamotrigine here also. LA. L is Lamotrigine. LA. So now you got another drug which has got widest range of action, that is Lamotrigine. So friends, in the coming exam, there are high chances that you will get a question on Lamotrigine as a first line treatment or a widest range of action Lamotrigine. So remember, if they ask you first line treatment of any epilepsy, if Lamotrigine is there, you should go for that, or the widest range of action Lamotrigine. Now I'm sure all of you must be thinking, suppose in the question if both are there, what to choose? Both will never be there. I repeat again, both options will never be there in the same question, because these questions are being set by the very high profile professors of AIMS and the various prestigious institute, and they will never commit this blunder mistake of keeping two drugs having same type of action. So quite possible that he may ask the question to you, drug having widest range of action, he may shift, he may not. The option will be Lamotrigine, carbamazepine, phenytoin, gabapentin. Answer should be Lamotrigine. Widest range of action of first line treatment again should be Lamotrigine. But there is one big problem with Lamotrigine. Lamotrigine has one big problem is it can lead to extensive skin lesion, skin side effect. It can lead to extensive exfoliative dermatitis. It can even lead to extensive necrosis also. That's one big drawback of this drug. So otherwise, first line treatment or widest range of anti-epileptic action, both answer remain is Lamotrigine. Got it? So friend, till now what I told you, you have to remember only two words. One is valproate and other is Lamotrigine. Okay? So now let's talk about what are the newer drugs which have been recently introduced for the treatment of anti-epileptic drugs. So newer drugs for epilepsy are newer drugs. First is tiripantol. It increases GABA activity. Second new drug is reticabine. This is a unique drug. This is only anti-epileptic drug which act via opening potassium channels. Third, we have perampanel. It is a AMP receptor blocker. AMP receptor blocker. Then we have rufinamide. In fact, this question came 2 years back in AIMS exam. Rufinamide, MIDE. It is we use for Lennox Gastaut syndrome. And of course we got progabalide. It also increases GABA. So friends, today I told you about